Hi, I'm Chris Paul. I work as a counsellor in the Swindon, Marlborough and Hungerford area. And I want to talk a little bit today about loss and grief and bereavement. And I'm putting all of those together because the way we experience loss and bereavement is often very similar, but is a question of degree. So the feelings, thoughts, behaviours and activities that we have when we lose something like a job can be similar to losing a life partner. Though obviously if you lose a life partner, they're likely to be far more intense and go on for longer. Also, our attitude within British society to loss and grief and bereavement is often one of you're expected to feel sad for a certain amount of time, then get over it and just sort of pick yourself up and get on with it. And often the time frame for that to happen is unrealistic. Someone who loses a partner, whose partner dies, there'll be support, sympathy, maybe for several weeks, for several months. After that, people start to ask, well, has this gone on for too long? Should I be feeling better now? And the truth of it, that normal grieving can often go on for months and years, and everyone's different in that respect. There's no right way to do it. But we have a model that people will grieve for a few weeks, get back to work, still be sad for maybe a few months, and then everything will be fine. Well, that's usually not the case. Now, the symptoms I'm talking about are things like sadness, feelings of anger, maybe anger towards yourself, anger towards the person who's died, if it's some other sort of loss, anger towards whatever reason you think the loss has occurred. There might also be feelings of guilt related to something. Fatigue can be very common, feeling listless, or even feeling you can't get out of bed in the morning. And that can go on for quite a long time as well. And there's no right way to feel either. Some of the things that come up can be very surprising and appear to have no resemblance to what has occurred. But often they're part of the grieving process. Thoughts that come up, it's very normal to think in ways which you did before and suddenly have that moment when you realise, actually, that person's dead. The thoughts that come up can be quite intrusive. You will naturally dwell upon thoughts of the person in the past, or thoughts about what something was like before you lost it. And they can be intrusive, they can disturb your sleep, they can come into your dreams. Again, it's normal, natural part of the grief process. It's part of your mind processing what's gone on and coming to terms with the new situation. You may get physical sensations. Can be a tightness in the chest, the throat, dry mouth, listlessness, weakness, feelings of anxiety and tension building up in your body. You can have headaches. And with these sort of things, people kind of expect sadness. But when you get the physical sensations coming up, people often think that something's wrong. And you if you do have, say, chest pains, get checked by your doctor. But chances are that this is related to grieving and is something that you need to allow to happen. By all means, take care of yourself and look after that. But the reaction of pushing away, I shouldn't feel like this, I shouldn't have these sensations, these thoughts, that they shouldn't be there, I need to get on with it. That sort of reaction will often make it worse. It's like almost like you push something away and it springs back at you, as if there's a rubber band holding it in place. And that will all affect your behaviour as well, and it will naturally do so. You may become more withdrawn during the process. People will say, what's wrong? You need to get out and see people. Well, actually, you might just need time on yourself. You may also do things that may seem obsessive. You may want to hold on to possessions of the deceased, or things that were relevant before your loss, and that's normal. It's natural. You need time to be with that. And if you're going to move through the grief and allow it to flow through you, then actually those behaviours are not obsessive. They're ways of remembering and processing. There may be other things which are related. It may be you might drink a bit more. You might become a little bit more obsessive about cleaning or other activity. And that, again, is quite natural. It's something to just let happen. Keep your eye on it, because at some point you can tip over into a behaviour which is just a distraction and stops you experiencing the necessary feelings and sensations of grief. But again, it's normal. And where we'll often get a problem, where we get stuck in grief, is when we think, right, I've got 2 months, I'm going to grieve for 2 months and then I'll be fine and I'll get on with it, which is a message we might get. It might be 2 months, it might be 3 months or some other time span. But we often get that sort of message from society. Okay, a couple of weeks have gone, back to work, back to normal. And that's deeply unhelpful, because anything that you do not allow to flow through you gets stuck in you. You might think of it like a river. If you stop it flowing, the pressure of the water builds up because it's still coming. But eventually, if you let it flow through you, then while that might be uncomfortable, it will pass. It will pass. But when we dam up the feelings, the sensations, when we stop ourselves doing things we need to do, then often that's where we'll get stuck, and you may never actually fully finish grieving. That's something that maybe has to be accepted, because things will never fully be the same again, especially if you're thinking of the death of a parent or the death of a lifelong partner. Things will never be the same again, and it's okay to have some grief remaining. And people will ask me, and sometimes ask me, well, how do I get through this? And I come back to you experience it, don't push it away, and just allow it to be, and treat yourself accordingly. Yeah, we can get very harsh on ourselves when we think we should be over something. Well, being gentle and treating yourself gently, allowing yourself time for your grief process to do things to remember, to look at the photos, to visit the grave, to think about what happened. Yeah, giving yourself time is the way forwards often. And once again, don't consign it to, okay, right, well, on the anniversary I will grieve. Your grieving process may need to be every day. It may need to be every week. You might need some time each month to sort of experience it. If you're supporting someone who's grieving, then what they will often find most useful is just someone to listen. You don't need to give them a pep talk and say, yeah, it's dreadful, but you need to get over this now, stop, buck up. That's going to be unhelpful. And often little things will mean a lot to people who are grieving, just the little remembrance, maybe on an anniversary, of what has happened. And just being thoughtful and kind. So if you find yourself in the position of supporting someone, also notice that can be difficult for you. It's very difficult when a friend or a partner is going through a process of grief, especially if you don't necessarily understand it yourself, which might be the case if it's not an obvious loss, but something that meant something to them. If you want to know more about this, me, or counselling, you can look at my website. That's www.createadifference.org.uk. And other than that, I hope these words have been useful for you, and I wish you well.